let any of the team know if you need them to make any contacts or anything whilst we're trying to do this. So I can see, Alison, how many people were we expecting to join us? We've got, I can see they're joining all the time, but we're up to almost 40 people on this call at the moment.
Well, Tracy, I had about 10 to 11 confirmed, so I think, yeah, looks like people. But it was the same conference membership from last time, so that was about 100. So yes, plus a few more.
Okay, so we'll get going if that's all right with everybody. So good afternoon, everybody. I'm Tracy Rudling. I'm the Chief Exec of Community 360. And this conference this afternoon is very much done from a partnership perspective, ensuring that everybody has the ability to join and speak. This is also very much a listening to action conference again, and we'll go through some of the actions that have been picked up from the previous listening exercise at the end of August. So just in respect of some Teams etiquette, I think we've all got very much used to operating in this this mode now, but we will be recording this afternoon. And if I could ask everybody that's not speaking to put themselves on mute, that would be really helpful, and then we don't get the feedback echo that often happens. So if you wouldn't mind just putting your recorders on mute, that will be wonderful. So I'm pleased to see so many faces and new faces that have joined us again this afternoon as well. So I'll just do a little bit of a recap on what happened at the last conference that we had. And from that conference, we produced a conference report that everybody should have received. And if you haven't, then just let Alison know or put your email in the chat and we'll make sure that you received that. We also had a recording from the event that is being circulated. And again, let us know if you haven't received that, because it was really great to listen to so many people talking about their experiences. And when I say it was great, I mean that in the terms of giving you the platform for participation. Not great to hear the inequalities, you know, and what COVID has brought to the table for you all, and for us all actually, which is very sad. So we've also started to develop an action plan that's absolutely been co-designed and produced by many of you that are on the call today, and our senior BAME leaders as well, about how do we want to take this forward. So today we're going to do, again, a little bit of a listing, but today it's more about the youth and students and their experience around the place that they find themselves either studying or living in. So we'll hear a lot around that. And the other thing that I wanted to add is from all of your work that you've been doing, we did a presentation for the North East Essex Health Alliance about 3 weeks ago, again, which was just a sort of a line in the sand about what we've learned, what we've heard, and how we want to take this action plan forward. And then on top of that, there's also been various areas that I've been able to talk to senior leaders, Colchester ambassadors yesterday, so I represent, I'm on that group as well. So there's lots of other platforms and areas that we're able to influence and get your messages across. And the whole idea of this is that we start to develop the action plan so that we can really turn some of this into your place, your space around what does your leadership look like going forward, and that monthly forum from the leadership, how we take forward the health inequalities around the primary care networks work and the alliance work, how we developed and how do we continue to develop an asset-based community development approach with CORMAT from nurture development. And at the moment we're working up what does a plan, a suite of tools look like in respect of leadership, confidence building, active participation in your communities, which I have to say, absolutely, you guys are excellent at. And what we want to do is step out of the way, but give you all the tools in the toolbox to do more and thrive much more. And then the other piece of work that we want to take forward is to be able to develop a robust bursary pot that can be cascaded. Community 360, One Colchester, etc., Tendring District Council may act as that conduit for that bursary pot, but making sure that we get some of that funding onto the ground at that level for you to spend on how we develop going forward. So I'm going to stop there and just pass over to Alison Morris, who a lot of you will already know. And Alison will give you a little bit of an update on the work that she's been doing so far on developing the plan. So Alison, if I hand over to you, do you want to give the group a little bit of an update on what you've been working on? Because I know you've been doing a lot of work on the ground around flu jab days and lots of other items. So I'll be quiet and give the floor to you.
Thank you, Tracy. I have got a little PowerPoint presentation. So I'll try and share that with you. Give me a minute. Hopefully. Okay, can everyone see that?
Yes, we can.
Good. So just a short presentation, just looking at some of the work that's come out of the last August conference, and also perhaps work that we can take forward with you in the future. I've also got a few photographs from our local community member, Grace Bedding. She's a local pastor and a photographer. And these are the photographs that she took while in lockdown, while lockdown was happening. And these are her thoughts on community. Thank you, Grace. I don't know if she's here, but she was hoping to join us. So the piece of work that we're doing is really focusing on communication. So opening the channels of communication between BAME leadership and community workers and people who want to have a voice and statutory bodies. So it's really keeping those communication channels free flowing. Consultation, the focus is on consultation, so that's not disempowering people, that's actually listening to people and working alongside them. And decision making is important, so effecting change here is what we're looking for. So what we're doing, we're listening and learning. So out of the last conference, we had some issues arising that have been affecting our local communities. And we have started to link individuals, leadership within the BAME groups and community workers with people in statutory bodies. And we're really working towards changing health inequalities in our area. We've started doing some task and finish groups. So they're basically working groups, inviting individuals from our BAME communities and working in partnership with you guys to define the issues that have come out of COVID around health and other areas and effecting change. So the emphasis is on consultation and action, and during the last August conference we heard a number of issues. There's just a few points that have been raised, So community struggles with interpretation and medical appointments in hospitals and GPs. It's been a struggle for forever, actually. I know we'll probably hear from Uday and Pramila that this has been a particular problem within our Nepalese elder community who have very little English. So how do they get their medical problems heard in confidence and within confidentiality rules? Other areas of concern have been access to health information and language issues. So we heard in the conference last that there were mixed messages coming through, people listening to other states' health information and our own government and NHS advice. And also a very bad situation that we heard from Maria Wilby's group, Colchester Refugee Action, was about asylum seekers whose applications for asylum have been turned down, but they are still within our community, and they are suffering from homelessness and in desperation. So she spoke very vividly about people on our streets today in that circumstance. So these are problems that are all of our problems, aren't they? So we've started some task and finish groups, so working groups, and one of the groups that we had recently, we looked at the winter flu vaccination. So we invited some community workers, Dilek, Satish and Pramila, to meet with a team from the North East Essex CCG. And they had a very quick fire, agile pop-up meeting, and the discussion centred around communities not knowing where to get the flu jab, the flu vaccination, and also cultural and religious problems around the vaccination to do with the makeup of the vaccine. Does it contain egg? Does it contain pork? And so forth. So a very rapid action point was made out of that group, and it was centering on video making. So the idea is to make short videos disseminating information about the flu virus, which can enter into certain communities quickly. So that's an example of the work that we've already done from the last conference. So we've also been asking our keynote speakers from the conferences, what one thing would help you? Give us a recommendation. So what would have helped you in the last months, over the course of the last months, and what would help you in future? And this is what we heard, some of the comments, and these are from our younger members. We're inviting you to register your interest with us. So if you want to work alongside on a task and finish group or any other piece of work that Tracy's outlined to you, or in any way, including funding, please let us know. You can either email me or Tracy, or give us a call, or even enter onto the chat line here. So that's who we are, as you know. And we'll end with another lovely bunch of photos from Grace. Thank you, Grace.
Thank you. Thanks, Alison. That's great. And it's really nice to see that actually some of the listening has already started to turn into action, which is going to make a huge difference on the ground. And that's why we're all sitting here this afternoon. We want to make a difference. We want to make sure that it changes things on the ground. So have we got Elif on now?
I don't think we're going to get Elif. I think she's struggling with her. She's Elif.
She has joined.
Can you see me? Can you see me?
I can't see you, but I think you're on. But we can hear you. We can hear you. So that's
the floor is yours.
Sorry?
The floor is yours.
Thank you. I'm sorry I couldn't join. There was a problem with the app, but I'm on now, thankfully. So yeah, I was just going to explain my experience. lockdown and when COVID hit, when the pandemic started. For me personally, it was very, very difficult. The lack of advice, nobody really knew what was going on at the time. So for students, we faced a lot of difficulties. We didn't know if we could use the library services because we were being told not to go outside, but the library was still open. We didn't know if we can use the student classrooms. So for me, my main problems was being a student, really. So that was my main difficulties. Nobody knew if we could go home, see our families, because we were being told that there was such big fines for leaving your house if it's not essential, and nobody really defined what essential meant. So yeah, that was quite terrible, not being able to know if we can go home, see our families, spend time with our families, if we can just leave university halls, to be honest with you. This was obviously really difficult. Personally, for me, it was really difficult on my mental health. I had such bad anxiety. I didn't know if I go out, am I going to catch the virus? How do I catch this virus? There was, we would go to Tesco's, myself and other students, we would go to Tesco's and there would be no rice, there would be no pasta, there'd be no cleaning products. Stocks are limited. When we'd ask the customer advisors when they're going to be in the stock, they tell us we can't really tell you because we don't know ourselves. So yeah, that was really bad on my mental health and my friends' mental health, my people that I know. It was really difficult for them because people were going crazy. They were doing extreme cleaning in the flat. They were yeah, it was that was quite funny. So yeah, that was difficult. When it came to myself, so obviously I said how it was difficult for myself, but I also had to help my friends, for my international friends, because they didn't, the same way that I was struggling, you can imagine how they were struggling, because some of them can't really understand. They've come to another country. What we're hearing from the news, the advice is really vague. So I'm having to trying to understand it myself and then translate for my friends as well, for my international friends. And they had the problem with the flights, not knowing if they can fly out, because there was a lot of countries shut their borders immediately, and there were no flights going out. My friend, thankfully, one of my friends found a flight for students or people that had to return back to the country, so people who are actually citizens of the country. So yeah, I know international students faced a lot of struggles as well, if not more than UK students did, because they don't really understand. They don't understand what's going on in the news. They don't understand, because a lot of it was contradictive as well, because I know members of parliament were giving us advice, but they weren't following it themselves. So that was confusing.
Yeah, I think that's a story perhaps for another day. But thank you ever so much for that. Can I just reflect back what I think we heard from you, that there was some issues around translation, again about the messaging and how clear that was for you all. Yeah. Some serious issues around specialisms on food, and we've heard that a couple of times now, and also around the mental health issues. And what about your ability to navigate and access services? Did you not know where to go? Did you, how was that for you?
Do you mean as in health services?
Yeah, absolutely, health services, but also organisations such as us that could have helped you, and so I want to hear that if you didn't know that we were there, or that message hasn't got out, and communication was a big thing, I've picked that up as well. We need to do better, clearly.
So yeah, when it came to services such as yourselves or other organisations as well. I personally didn't know, because we're already locked in a bubble in our own rooms, and the only way that we're going to get these things is by emails or just being reached out to, really. I know I heard as well from Alison that people were uploading it through social medias. But the one problem with that is with the social media algorithms as well. So you don't actually see these posts. So you don't. I personally didn't see them. I only got my advice from the university, and with the university, they didn't offer us help as to who we can turn to for mental health advice, or who we can turn to for how to get food, cultural foods. I couldn't find I'm from Turkey. I couldn't find Turkish food. You're not going to find Turkish food in Tesco's. I couldn't go to the grocery stores, the international grocery stores in town, because it was an essential.
Okay, so thank you for that, and it's really interesting about the communications issue, because there's a lot of linkages, but clearly there's something for me that says we need to do better. If anyone has got any questions or observations, can they pop them in the chat, please? We have got a question and answer session at about 5 o'clock, so we'll pick them up there. But also start having conversations in the chat, because that will also be really good. So next on the list, so thank you for that, Elif, is Vinosh.
Yes, yep. Hi, everyone. Before I start, I will thoroughly apologize. I don't really use Microsoft Teams a lot. We use Zoom, so I'm not very familiar with the settings, so I'm just leaving it as it is. So, yes, hello. My name is Vinosh Kumar. I'm the Vice President of Welfare at the University of Essex Students' Union. And so or anything that's related to health and safety, finance, and human resources falls under my remit. I did send Alison slides, and I don't know whether she's able to share them from her side.
Vinosh, I think I might have your slides. Let me have a look.
Yeah, I'm very unsure how to share on Microsoft Teams.
Okay, if you carry on, and I'll.
Yeah, so a big part of my role these past couple of months has essentially been going to students, reaching out to them on social media, and those who are on campus, self-isolating, to speak to them about their experiences. One of the things that we have flagged up this particular year is about how to tackle loneliness, because that's been a recurring issue to many students. And external organizations that we work with have been focused on disseminating the information around COVID-19 more than tackling the kind of social issues that come with COVID-19. And I was a student right up to June, so I was doing my law degree then, so I completely reiterate Elif's opinions on that. It was a very hard time. I'm from Malaysia, so you know the quickness in which the situation changed was not very easily bearable, simply because at one point the government just turned around and said, okay, the borders are closed, the flights are cancelled, you can't go back home. And then many students who were reaching at the end of the course were saying, well, my visa is about to expire, I'm going to be staying in the UK illegally, kind of thing. And so the mismanagement of a lot of information in particular disenfranchised a lot of international students. And I think that's where the external. It's very tricky, simply because there's a lot of information going out, but at the same time, we often come back to the root problem of, is the information being disseminated on the right platform? It's easy for us to turn around and kind of say, okay, let's put it on Facebook, let's put it on Twitter, let's put it on Instagram. Most of our Chinese students are very commonly use a platform called WeChat. So it's these little things that we don't really take into consideration, because we've been quite dependent on, having those corridor conversations with other people. When we cross squares, normally when something big happens, you are having a chat about it, you're having a conversation about it, but, in a completely digitalized world where you're isolated and where staring at the screen is kind of your one way to get information, that's something that we're really looking into this upcoming year. So yeah.
Hi, Vinosh. Vinosh,
Yeah.
I have your presentation. Do you want to give your presentation, or do you want to carry on?
No, I'll give the presentation first. It helps with the points.
Okay. If you carry on chatting just a minute.
Yeah. So yeah, there's I think we are doing a lot of work at the moment to take care, particularly mental health and higher education. You know, traditionally, there's always been a consensus that, you know, there's not enough support for people working in mental health and for, you know, public mental health. But this is my presentation. So what we're going to talk about today is students in higher education sector within a COVID-19 world. Oh, can I actually click it? Yes, I can. Oh, that's brilliant. So kind of to cut on the basis, you know, in a university setting, the biggest thing is about what learning looks like. And most universities have gone mostly online. So it's the same in Essex. It's the most safest way. So first term is mostly online. It's only for degrees that require practical laboratory-based kind of, not to say exercise, but courses, where to meet the learning outcomes, they would have to physically be there. Those are the students who are being currently given priority to come back onto campus. So second and third term is looking at blended learning. So departments are slowly, as quickly as they can, trying to phase back their students into the classrooms, because you know, one of the observations we've had, especially once classes started, is that you don't really have that rapport with your lecturers or your classmates when you're on Zoom. So it makes the progression of ideas a lot more difficult. So we're trying to, you know, as safely as possible, trying to get the students back onto campus. We are enforcing a policy of wearing face masks on campus. We are encouraging students to wear it outdoors as well, but it is mandatory to wear them when you're entering into enclosed areas. So that's where we're at with kind of learning for this term, for this year. Ooh. So the tips and advice I can give for students, in particular to reassure them and to protect themselves, is to wear a mask at all times if you can when you're outdoors. We have recognized that some people can't wear masks for medical reasons, and the university is working to issue lanyards that say that someone is exempt from wearing a mask. And we are trying to promote people to buy see-through masks. So people who, oh, I don't know how to phrase this. People who can't, oh God, I don't know how to phrase this. People who depend on the movement of the mouth to interpret certain words. Yes, yeah. So we are trying to encourage people to get those types of masks so that it's a lot more accessible to everyone. We are encouraging students to stick to their rule of 6 social bubbles and stick with them, just to make sure that they're not mixing around too much, so that the transfer of kind of airborne particles is limited. And we are pushing them to attend and engage with online events as much as we can. Traditionally, it was always the fact that the university would have their set of events and we would have ours, but going forward this year, we're trying our best to merge both of our events to ensure that students are getting the most out of it. And one of the benefits of this year, and the situation is particular, is that it has given us more room to collaboratively work together. So the challenges that students face, and this is ongoing discussions that we have almost every single day, isolation and loneliness. You know, we don't know the long-term impacts of, you know, what the quarantine months did, let alone, you know, how students will feel coming into higher education in this particularly difficult time. So we are trying to reach out to those students, because very often there are many students who are struggling and, you know, they feel that they're all alone. And we are trying to encourage those students who feel that they are isolated in the issues and the matters that they are facing to come forward and say, well, actually, there is help and support available. You know, there are people that you can talk to, and it's really about pushing them to say, well, actually, there's nothing wrong with raising your hand and saying, you know, I need some help, I need some guidance. Progression in academia is also something that we're really kind of looking into. I say kind of, we really are looking into it, because one of the things we are worried about is that because students aren't having as much opportunities to mix with their colleagues or their, you know, their peers in the classrooms, we feel that, you know, those kind of analytical skills and those debating skills will suffer in degrees such as government, politics, and law, and many others that require, all degrees require critical thinking. And so it's something that we are hoping that we can kind of solve, per se. So building connections within student communities as well. This was particularly focused on our liberation communities. So the Women's Network, the LGBT+ network, the Disabled Network, mature students, parent students as well. And normally during the meetups, you know, there was always an opportunity on campus to kind of go for these social meetings and kind of meet people who have something in common with you. And we have been able, to a certain extent, recreate that. So we've been having socially distanced events physically on campus on Square 3, which has seen a lot of engagement, which is really good. People, as long as, you know, we always keep an eye on the fact that people are maintaining their distance and wearing their masks, but it has proven to have a lot higher engagement than usual. And one of the reasons why we feel that is because students feel that coming out of their accommodation is now a privilege. It's not a leniency that you know, you can't just walk out the door anymore. It's, you know, it's reached a point where some students have said, I feel like the air is dangerous, which is concerning. But yeah. So, and corridor conversations is also something that we've used this term a lot in all of our meetings. Corridor conversations, you know, when you finish the class and you're talking to, you know, your classmate as you leave the hallway, how do we recreate that atmosphere online? How do we, you know, kind of say to a student, well, actually, you can have those conversations on Zoom. It's a tricky one, it's a difficult one, but it's something that we are hoping to find solutions for. Yeah.
I'm just being asked if we can move the presentation forward because it seems to be stuck on tips and advice for students. Who's got the...
Oh.
I think you've got joint control, haven't you? Because I think I've got control as well of it. But
yeah, I mean, this is the last slide.
Okay.
Yeah, so one of the solutions that we've kind of come forward at the moment is individualized support from our Student Wellbeing and Inclusivity Service. So they have sent out a link, and 750 students have replied to that link. So we're trying to see how we can curate the support that individual students need at this point of time. There's been a massive push wherever we can for online events and physical events to happen. And you know, the solution for isolation and loneliness is something that is an ongoing conversation that we're having. So yeah, that's the end of it. I don't know how to stop the share, so I'm hoping someone who has control can do that for me, please.
We'll get Alison to stop the share. Yeah. Thank you for that.
That's all right.
And there's quite a lot of stuff in the chat around face masks and the different ones that you can access as well. So thank you ever so much for giving us some information and the heads up on what's been going on in your world as well. So moving on, have we got Pramila here?
Oh yeah, hello.
Hello.
If you can, let me see. Okay, I'm here. Oh, there you are. Okay.
Alison, can you share the slides, please?
Yeah, I'm quite glitchy. Okay. Is that clear now? Are we clear now?
It is now, thank you.
Okay. Hello, everybody. I'm Pramila, and I'm one of the volunteers for Community 360. And today I will be representing Colchester Nepalese community, and we'll be talking about like different issues faced by different age groups in my community. So first I would go talk about the youth. Nepalese youths. Like Elif and Vinosh, most of the youths are either basically studying or were graduating this year, so they have similar issues as Elif and Binosh have mentioned, like obviously online classes, not being able to pay attention, online exams compared to like traditional exams, how difficult that was, not being able to graduate and celebrate their successes and stuff like that. It's been like, yeah, the Nepalese community youth have faced the same problems. And also big issue is definitely mental health, because the youth want to go socialize, but they can't because of the virus. And obviously the government is like changing the rules all the time. So yeah, so those are the things. But however, I'd say Nepalese community youth are a little bit different in a sense. Some of them live with their families, so maybe then they're not living by themselves, so they are more worried about passing the virus to maybe their elderly grandparents, or maybe their parents are high risk. So being living in a basically family environment, there's that worry of passing the virus for them, which is a little bit different, I guess. Any different others, I would say the way they get their COVID news is mostly from social media. I'm sure it's also similar to obviously the youth here in UK anyway. But maybe their family members will also ask or tell them about it as well, so they're covered in that way. Okay, I'll move on to my experience. So my experience has been a little bit different. I was actually abroad till June. I came back in June. So booking flights were very hard. So at that time, BA, I had booked flights with BA, but they stopped. I was in Japan, so they stopped basically the flights to Japan, and I had to basically go to Korea in order to come to UK. So again, getting the news from, I had to always check the British embassy, Tokyo, all the time on the news to see like where I can get flights. They were quite detailed, I have to say, with the flights, but I had a hard time basically getting information on what the airport is gonna be like. So in Japan it was fine. They just had to do temperature checks, and I went to Korea. Korea was a bit strict. They had to do corona test when I actually arrived there because of a high temperature. And then after getting the results, I could fly back to UK. And in UK, I was so surprised at how lax the airport was. I had like no temperature checks or anything, and I just had scanned my passport and I was let in, and I was like, really? I thought we were, there's pandemic here. There's like, I was so shocked. But the only thing that was good was like they told us to obviously order a taxi, private taxi, don't use public transport. And there was no information on you need to, do 2-week quarantine. I thought they would give us leaflets, check our temperatures, and tell us please stay home and this kind of stuff. But there was none of that, which was I was really, really surprised about. But anyway, I think the rules changed a little bit after that week, but still, I don't think it was very strict. So I wish the traveling regulation were more stricter. Then maybe it would, like, the COVID virus like rates won't be that like high. And I did my quarantine, and finding jobs were a bit harder for me as well, as I think for everybody at the moment. So those were the issues I faced. And nowadays, again, it's just getting jobs, staying home, and I guess it depends on your personality as well. But you can't always be staying at home, even if you're an introvert anyway. So I think just social distancing and just not being able to go out and enjoy yourself is a bit hard mentally. So that's my views, I guess. So going on to older people, older Nepalese people, they had some older Nepalese people live with their family, so it's okay. But the people I think who are having tough time is people without basically their children. So maybe they're just living alone, and they have obviously language problems. So there's nobody to shop for them, and maybe get their medication as well. So during lockdown, I think most of them ask their neighbors. So the Nepalese community kind of know each other, so they can kind of call on other people to either translate or call their GPs, or can you do my shopping for me, that kind of stuff, which is quite good. But I don't know, maybe there needs to be something more. But I think the chairman of Colchester Nepalese community is talking after me, so I think he will tell you more about what he did during lockdown as well. Yeah. And last time we talked about flu jabs. At the moment, I called some GPs, but it's been hard to get flu jabs. Still, I think you have to be 65 and over, or some people told me you still need to have like some underlying health issues to get it as well. So those. And most of elderly people get their news from the BFBS radio. It's like a military Nepalese radio, which is good. And obviously the Colchester Nepalese community as well. Yeah. Okay, that's it for me. Thank you.
Lovely, thank you for that. That was a really good roundup. But do you know the scary thing that I've heard again this afternoon is that every one of our speakers has talked about mental health issues, and it's just coming across the board, isn't it, around how we've been I suppose, you know, that isolation, that lack of communication, that being scared about the information, am I doing the right thing or the wrong thing? And it's all elevated everybody's anxiety, hasn't it, around this? So thank you ever so much. And I'm really pleased to introduce Uday next, and I haven't seen him for ages, so it's really nice to for him to be on the call.
That's fine. Alison, are you ready there? No, don't come. My grandson is here as well. Don't stay away. Oh, come on. Shh.
Hi, Uday. So I'm trying to share Uday's presentation. So tell me if you can see this.
No, come on.
Can everyone see that?
We can.
Can you go back, please? Just bring up one by one, please, rather than everything together.
I think that's the way it's gonna.
No, I think you need to go on the top there. Can you go down below and then put on the slideshow? It should come up. Oh, it's all gone. Okay, can you go back then, please? Back to the top.
That's your first one.
Okay.
Yeah.
If you go into slideshow, Alison, at the top, then it will come up as a slideshow. From the beginning. That's it. Hit the from the beginning. Done. Thank you.
No, it has gone. Anyway, I will carry on. Good afternoon, everyone. I'm Major Retired Uday Bahadur Gurung, MBE. I have been the chairman of the Nepalese Society for the last 13, 14 years, and I know what am I doing. In terms of Colchester Nepalese Society, I think we are not too bad position. We have done as much as we can for the benefit of the members. The members are just over 1,300 in 314 households. Oh, what happened? You have gone too far away. Can you go back, please?
Sorry, I'm not quite sure how to go back, to be honest. Oh, there we are.
You should come,
Yeah. My colleague Flavia should be able to take over, Uday. Sorry.
What is Flavia? Is he around?
Yeah, Flavia is here, and she should be taking control of it, I hope.
Okay.
Is this the right one you want to see, Uday?
Yeah, that's
perfect.
One. Right, there are about 1,300 people in 314 households, and it's increasing. The people in Colchester are doctors, running international IT businesses, IT consultants. There are some accountants, maximum number of nurses working for the NHS, maximum care home workers working for the care homes, bus drivers running the town for the people, and security officers and food production teams as well. I have divided Colchester into 5 different areas to look after members' interests. They are at St. Michael's Estate, Gordon Road, Newtown, Highwood and Greenstead and Highwoods, and Garcombe itself. So there are 2 to 3 people as area representatives in each areas. So they are my eyes and ears. When the COVID-19 started, we have established a COVID-19 help group in the same 5 groups, in the groups as I mentioned already, and they are the people who go and do help the people in the community there. I send messages in Nepali scripts for the senior citizens, and some of them can't read Nepali either, and they are updated as and when the Prime Minister changes COVID-19 strategy. And similarly, we received an update from the Gorkha Welfare Trust in Salisbury, and I passed it across to them as well. We had 3 people isolated, 3 households rather, isolated because of COVID-19, and the health group did their shopping, collected their prescriptions, bought their medicines, and delivered to them. Some of the families cooked food and delivered to them as well. Health group always maintained social distancing and were wearing face masks all the time. We're lucky that no one became a victim of COVID-19. Do you want to go forward, please? Next slide. Yeah, click. Problems encountered. Sorry, before that, next of kin. I acted as acting next of kin for the senior citizens when they were admitted in hospital, visit GPs, and when doctors and community nurses were visiting at their flat. Because I have been doing that this morning as well, because one of the woman is admitted in the hospital. She had a procedure yesterday, and it was so difficult to talk to them. The problems encounters were some of the doctors and nurses were so grateful as I was translating between the two. Still, some of the doctors and nurses didn't like to see me translating. They said it was because of GDPR, they were unable to share patient confidentiality. So it was a really problem there, because I wanted to help them and they can't be helped. I don't know what is going to what is going to happen to them in the future if they don't allow me to do that. We had 2 deaths in the community, not due to COVID-19. It was normal deaths. We have carried out their rituals and funerals. Similar problems encountered with the council as well. Captain Westpoon, MBO, and I were helping the widows when we were arranging the widows' job seekers allowance, pension credit, housing benefit, etc. Council staff were not willing to talk to us until the person was present. But they didn't understand the limitation we had during COVID-19. So it was a really bad problem there. Next one, administration. As Pramila said, We had a Nepali shop locally here. So they delivered food in their doorsteps. So there was no problem in order to get food from local shops, from the local Nepalese shop. There are two young couple running the shop there. Next slide, please. Laptops. We are providing laptops for the senior citizens to learn English language and online yoga classes from Colchester Borough Council Digital Access Team through Rachel. ADA reps, as I said before, they are my eyes and ears. They will go and visit members at their homes when a baby is born to congratulate them, when someone returns from the hospital to welcome them back to their home, when someone's parents die in Nepal to give them sympathy. But we will always keep COVID-19 safety precautions in mind. It is done to boost morale, support, and continuing community services during the pandemic with COVID-19 safety measures in mind. At the moment, we need a bit of an allotment because our elderly people wanted to do some work, not immediately, but in the future when COVID-19 goes, if we are given some allotment in Colchester would be nice, so that they can go and produce their own vegetables. Helping food bank. Colchester Nepalese Society is helping as much as we can by collecting dry food, handing over to Colchester Food Bank. That has been done twice already. We are going to be doing in the next time as well, but after the COVID-19, not before COVID-19. Helping Hand in Nepal, we have been assisting some of the relatives of the people living in here for their kidney operation as well as cancer treatment. We have managed to collect 1,980 pounds, 1980 pounds, and sent back to Nepal to do their kidney transplant. We're collecting at the moment some money again for a cancer patient. I think we have managed to collect about 1,545 pounds so far. So we are going to send that money tomorrow or day after tomorrow so that the cancer patient can be treated. Community spirit. We are trying our best to achieve community spirit and helping each other as much as possible, ensuring that no members are isolated. If it were not COVID-19, we would have been doing lots of activities and entertainment. Unfortunately, that can't be done now. But hopefully, once COVID-19 is gone, we will continue our theme again. Intergenerational and intercommunity integration. Again, if it were not COVID-19, we would have been doing plenty of intergenerational, generational, and intercommunity activities again. Because of COVID-19, we can't do anything at the moment. Affiliation. We're affiliated to Community 360, First Sight, AIDS Concern Colchester. Know quite a few personalities in Colchester Borough Council, Colchester Borough Homes, and councillors. So that's a plus point for us. Royal British Legion. We were supposed to be, collecting money for the British Legion towards next weekend or week after that for the 3 weeks. But unfortunately, I don't think that is going to be taking place this year. But otherwise, we would be there. I don't think this year is going to be taking place. Colchester Nepalese Society is a small but well-disciplined group of people and enjoying life in Colchester. And Colchester is our home, and we are proud to be Colchesterian. And I have spoken with all the senior citizens. They have told me that they have done, or they have almost got the flu jabs done for the senior citizens. I'm not worried about the youngsters because they can look after themselves. I'm only worried about the senior citizens, and they have all booked their flu jabs already. So looking good for the old people. I'm not worried too much about the young people because they can look after themselves. Thank you.
Thank you for that. And you know what? It's such a pleasure to. We're proud to have you, and I'm proud to have been working alongside you for so many years. It's been wonderful. So a couple of things there around. There's some stuff in the chat. The allotment. I think Community 360 Community Development team are looking at that at the moment. How we can provide that as a sort of partnership approach. So we'll get in touch with you around that. And then I put a little bit of a challenge out, and I'm not sure if Ed is still on the call, about the GDPR thing and your translation when you're with somebody that's really frightened. And although I know there's a translating service, but actually part of the support that you're given to loved ones is actually being there because they're scared and they're in a different country and it's different culture. So that might be something that we need to go back to Ed on around that GDPR question. I don't know if Ed is still on the call. If he wants to, I can't see. Hold on.
I think they should accept my my commitment, because they are paying money to the translator, and people don't the patient don't see the interpreter.
Good
so
point.
They know me very well, and they are quite confident with if I do the translation for them.
Well, absolutely, and also that patient is going to open up to you as well, isn't he, Uday, much more than what they would if it was a translator that they don't know and they don't trust, and they might hold some things back that you can get out of that. So it's a really good point, and thank you so much for sharing that. So moving on, should have Rachel and Rachel's guests.
Yes, I'm here. Thank you.
Hello, Rachel.
Hello, Tracy. Thank you so much, Tracy, and thank you also Community 360 as a whole, the whole team, for giving our young people this opportunity. I have Christian and already Tasfia on call. There are two others who are delayed on the bus, so they'll be with us soon. So, my name is Rachel Walton, co-founder of African Families in the UK. We run a youth club every Saturday at Townhouse. We reopened on 19th September during the lockdown, after the lockdown. But during the lockdown, we were having a virtual youth club every Friday and Saturday, and every day we had a one-to-one tuition. When we opened on 19th, our youth was so delighted. We had just allowed 25 youth in there. So we had to rethink very quickly because we were oversubscribed. So we have now two sets. The first set coming 10 till 1, and then the other one coming from 1:15 up to 3. There's a lady called Amy who said in her poem, youth leaves you quick and it never comes back. And that's what our youth have always been feeling. They have felt that they've been robbed their youth during this lockdown. The restrictions were too much for them. The digital divide, the lack of space in their homes, the set of routine was all gone. Human connections, their sports. And as Elf talked about, mentioned about international students, we had Elizabeth of Boa's project feeding quite a number of them to cultural food. I housed one of the international students because their flights, she could not get back to her home. So these are some of the issues that really affected our youth. I'll let first Tasfia share her experiences, and then I'll continue. Tasfia?
Hello.
Go on.
I'm a year 10, attending St. Helena's School,
during the lockdown, I did feel safe as I was home, even though I wasn't able to see my friends and family. We were in constant contact, so it wasn't so bad. However, now we have been rising in our area. There's been 4 confirmed cases in my school, including a teacher, of coronavirus. I'm scared of catching the virus unknowingly, and bringing it home. I'm living with my mum, who is in the shielding category, as she has stage 4 CKD. If I was to catch the virus, then I'd be putting my mum in risk. This is playing on my mind every day, and I'm concerned that there is no system in place to reassure her or me from catching the virus. I'm expected to go to school, which I think is wrong, as I'd be putting my mum at risk at all time. That's my opinion personally.
Thank you, Tasria, for sharing that. Christian, are you there? Christian? Christian, you are on mute. Christian, you're on mute. Christian?
Hello?
Okay, go on. It's your turn.
Hello?
Hello.
We can hear you, Christian. Off you go.
Hello, everyone.
Hello.
My name is Christian, and I am 11 years old. I don't know what to say, really.
Okay. Well, we'll refer back to Rachel, and then if you think about what you want to say, this is a big thing for you, isn't it? 11 years old. It's all these people on the screen, all these unknown people. But just to reassure you, what we wanted to just hear from you, Christian, is a little bit about your story and how you felt and how you felt through COVID, and whether you found it really scary, and whether what that felt like for you with your parents, or now that you're having to go to school. So I don't know if that was something that you were perhaps going to talk about, or.
Yeah, definitely.
Yeah.
Well, not seeing my friends was a big thing about the lockdown as well.
Okay.
Same with not seeing all my family members. That was a hard thing as well, because I was looking last year. I was looking forward for some of my family members coming this year.
Okay.
So, and they didn't come because of COVID-19.
Right.
Same with some of our friends from different countries.
Okay, and how are you getting on now? Are you back at school, and how are you feeling? You still anxious, or are you able to go to school? And
well, we are going to school, but the only bad thing about going to school during this time is we have to go to school, wear masks, do all these safety the safety instructions before we go inside school and all that.
okay, so do you think that how does that feel around you learning and concentrating?
Well, for me learning, a lot of students have actually lost the stats actually.
Right.
So some people can't do the stats, and the school that I'm in just put us in random places, so they don't know where we are in maths or English or anything.
Right.
So yeah.
Okay, so it's been difficult for you then, bless you.
Yeah.
Okay. Oh, well, thank you ever so much for coming on and sharing your story. That was very brave.
It's fine.
and hopefully we'll talk to you again at some stage. I'll revert back to you, Rachel. Thank you, Christian. That was really sweet.
Okay.
Thank you, Christian. I have Grace and Michael. Grace and Michael. They have just arrived from school. So, Grace and Michael, you there? Are you on mute, Grace and Michael? Okay. Oh, they are saying that they are not being let in the meeting. Oh.
There is nobody waiting.
Okay then, Rachel, have you got any more that you want to add? If we can get them into the meeting, we will. If not, have you got anything else that you want to add?
Yeah, I'll just add, so for us as an organization, we thought we would have helped our young people and in the community by having a helpline, which I have tagged as the Phone Video Calling Academy, which would have been manned by the youth themselves and their football coaches, their basket coaches, youth workers who were already their young people's icons. They missed their connections, and this would have been people who could have been able just to speak with them and reassure them of what was happening, because the messaging was not right for them. They didn't understand most of it. And we feel as an organization, because our youth are our future generations, they are the trustees. We are really feeling that this is a time when we need to commit ourselves to creating that more inclusive society through our youth engagement and emphasize on promoting health, education, and employment, because these were some of the things which really affected them. I have Natalie's poem, which Alison can share and see whether the other two will be able to get in, and that will be the end.
Hi, Rachel. Do you want me to share it?
Yeah, please do.
And then whilst you're bringing that up, next we'll just do a quick question and answer session, and then I'll just do the roundup of what we've heard so far this afternoon. That's not come up yet, Alison.
Taking its time, Tracy, sorry.
Okay. Is it something that you can read out, Rachel?
Or do you need when we can continue, and then Elizabeth, because it's one of our youth did the video clip.
Okay, I'm with you.
Yeah, so yeah, it's not me who is speaking in it.
Okay. All right, we'll give it another couple of seconds and then I'll just do some question and answer, see if we can get up. If anybody's got any questions that they want to ask, I'm just going to go in, and if you want to use the hands up facility, nothing at the moment. No, okay, so we'll just wait and see if Alison can get Rachel's video up.
Yeah, I'll try and share that now. I think it's in my...
Tristan, you got a question? And then Minerva. Sorry, Minerva.
Okay. Thank you, Tracy. I just wondered, is Vinesh still on the line? I hope he is still on the call.
I think Vince has left, Tristan. Okay, are we ready for the video, the poem?
Yes, please. We're all waiting in anticipation here.
Did you not hear that?
No, we haven't seen it or heard it.
It's not even on there. Yeah.
Yeah. Then maybe I can't share it, guys. I think I've got a problem with that then.
Do you want to send it to me in the meantime?
Sure.
Via email.
Rachel, have you got anything else you want to add before I start rounding things up?
No.
Okay. So, Minerva, you've got a question you wanted to ask.
Yes, thank you, Tracy. My questions for the speaker named Elif. She spoke beginning of the conference, and I would like to contact to her, and also Alison told me that I'm going to be volunteer for 360. So this is the first touch to the student who's from Turkey.
Ah,
yes.
Excellent. So nice connection there.
A very nice connection. So
okay.
I'm happy to be here to have the Turkish speakers then.
Okay, well, what we'll do is we'll send Elif your details, and then she can get in contact with you.
Yes,
and
exactly.
We can go from there.
Yes, please.
Okay, lovely. Oh, that's great that we've got some connections going on. That's what this is all about as well.
It is. It is. So I'm very happy for this.
Oh, we've got the video.
Yep.
Stuck in lockdown, can't go downtown, but I won't moan, for I still have my phone. Can't see my friends, but this isn't the end. When this is all done, still gonna be enjoying the summer sun. It's a great time to be sunbathing, but for this to be all over, I'm still waiting. Stay safe and stay home.
Okay, so was that one of your youth participants, Rachel?
Yes.
Was it? That was lovely. Thank you for sharing that with us.
Naturally.
That was worth the wait. So thank you. That was great. Have we got any more questions before I do a roundup? And I might be able to give you, I don't know, 10 minutes of your lives back if we're going to finish slightly early. I can't promise, but any more questions? No. So there's been an awful lot in the chat as well. And as you know, we're recording the conference this afternoon. So some things that I've picked up from today is about, you know, the anxiety that I think everyone suffered, not just our BAME community, but everybody, but understanding that it's been particularly difficult for you around mental health, and that's right across the sector as well. Communication's been a big issue for everybody, not getting the right information. I was particularly listening to our colleague that was talking about flying back in from Japan, and what shock that was to the system about us just letting people in without quarantine and so on and so forth. Something around translation and GDPR. I'm going to take that one up personally because I just I'm horrified, and I will speak to Ed Garrett about that. Specialist food, being able to get hold of and purchase specialist food, especially when you're told that you can't go out, and a lot of the smaller shops were closed, and just the bigger supermarkets were open. And what's really touched me, and I'm sure it has everybody else on the call this afternoon, is you know, our youngsters that we're just talking about, how frightened they are to go to school and how frightened they are to pick the pandemic up and take that back home to their families. And I know, you know, everybody's in that same position as well, but it's just you know, it's quite emotive to hear that. So, you know, we need to take that on board as well. And then something around the accessibility of being able to go out and get the flu jabs. And I think we need to take that one on board. And the great work that some of you have been doing to ensure that your senior citizens have been able to access and get to flu jabs. Please also let me know and come back to the 360 team if you struggle to get that, because part of the work that we're doing with the social prescribers is to ensure that people are having access to flu jabs, and also if we need to get you there by community transport or volunteer drivers just to make sure you're safe, then we'll make that happen as well. So unless there's any other questions, I'm just going to have, does any of my team see anything in the chat that I've missed? Now this is where you catch them out to see if they've been on the ball while we've been doing this.
I don't think we have any more questions. There are some comments on there. And I know that there's some things that we can pick up from the chat straight after here. And we said last time we'd share the video from the last conference, and we will do that. And for this one as well, we've just had a few technical things to figure out ourselves and how we do that as well. But we will share it with you all and make sure we follow up with any of the connections that people have requested as well.
Hey, welcome to the world of technology. Hey.
Hi, it's Sonia here from
Sonia.
Hello there, everybody. Great conference. Really enjoyed it. And what I've really picked up on is, like Tracy said, is the need for better communication. And that's something I'll pick up with Yvonne and Ruth Copperhouse as well, and see if we can get a meeting with the university as a first stop, just to see how and what methods of communication people would prefer as well.
Thank you for that, Sonia. That's great. Okay, so unless anybody has got a particular need to speak, then I will close conference down. No one, I can't see any hands up. So thank you. So it just leaves me to say thank you so much for your participation, everybody. And then next steps is going to look like actually coming together as a team partnership approach and looking at how we can bring some resource into the system around the asset-based community development suite of tools that I talked about, around leadership training and ensuring that actually you are at the table and it's not just a lip service type of approach. And so we will be putting a business case together and a plan and a budget, and we'll be sending that across to various funders for our system in Colchester to drive this agenda forward. And we'll just keep on listening and keep on turning this listening into action. I bid you all a really good evening, and let's keep chatting and connecting and making sure that we're doing the right thing throughout COVID.
All right. Stay safe. Stay well.
Thank you very much.
Thank you.
See you, everybody. Thank you.
Thank you, Lauren.
Okay. Thank you.
Thank you,
Bye
everybody.
bye.
Goodbye.
Thank you.
Thank you. Bye. Thank you.